Hello. Appreciative, and all of us at PATF and the Health Law Project are appreciative of all of you joining us today. We think it's a great webinar and certainly a wonderful way to exchange information during the coronavirus crisis. Before I begin, I wanted to first thank the HealthSpark Foundation and Russell Johnson. We are able to put on this presentation, and we had several in-person trainings in Montgomery County because we received a grant from this foundation to help inform its residents about community health choices. Okay, next slide. Pennsylvania Assistive Technology Foundation, PATF, we are a statewide nonprofit, and as you can see on the slide, we provide education and financing opportunities as well as advocacy for people with disabilities and older Pennsylvanians so they can acquire the assistive technology devices and services that improve the quality of their lives. You will hear more about assistive technology in this webinar, but I just want to say that we use the federal definition of assistive technology, which is the umbrella term for any device that helps a person with a disability or a senior do the things they want to do. So it's very broad. It expands beyond durable medical equipment. And in that last slide, you will have noticed, and maybe Amy, you can go back for a minute. I have pictures at the bottom, and on the bottom left is our hand controls, and then someone who's using a power wheelchair and a very clever shovel to clear their driveway, ramps, smart home devices, and lastly, off to the right, we have a family who is using an iPad to communicate. Next slide. And we have 3 programs, and we provide information about assistive technology funding resources and vendors that may be able to help them, financial education, and low interest and no interest loans with no fees ever. You can find information about us at our website, patf.us. And we help people of all ages, all income levels, all disabilities, and all health conditions. So think of PATF as all things to people in Pennsylvania, and we can hook you up to other states if you have colleagues there. And lastly, before I turn this over to our co-presenter, Amy, I want to say that at the top of our website, and again, it's PATF for Pennsylvania Assistive Technology Foundation.us, you will see a link to the Community Health Choices Toolkit, which is information and several handouts that will accompany this webinar, but also helpful in your own offices and helpful to learn about how to appeal and what is person-centered planning. So I would suggest all of you, when you get a chance, to go on that website and download whatever it is that you think would be helpful. Okay, Amy.
Thank you, Susan. So this is Amy Lowenstein. As Kayla mentioned, I'm a supervising attorney at the Pennsylvania Health Law Project. And like PATF, we are also a statewide nonprofit organization, but we are a legal organization. And our focus is ensuring access to public health coverage and services. This includes primarily Medicaid. So that's really the focus of our work and the focus of this presentation today. So what we do is we have a helpline for clients and advocates. That helpline is open during the COVID-19 crisis. It is not live answer right now, but at the very end of the presentation, there is a phone number you can call to if somebody has any issues or concerns related to accessing healthcare, accessing services, or accessing Medicaid. Just so you know, on this slide, there is an email, staff@phlp.org, which can be also used to get help from our helpline. and it can be used by advocates for technical assistance with any issues that arise for your clients or patients or consumers. So our assistance is free to everybody. We do not have eligibility restrictions, and it includes advice as well as full legal representations at hearings and appeals. We also do community education and have produced a number of self-help materials in order to help people through different processes in Medicaid. So how to apply for Medicaid, information about very specific types of Medicaid programs, how to do appeals. We also do a monthly newsletter. You can join it at staff@phlp.org. The monthly newsletter is really to keep people apprised of developments in Medicaid. Its primary focus is Pennsylvania, but we do cover national issues as well. And our upcoming issue, which will be our next issue, is going to focus a lot on what is happening with COVID-19 response in the Medicaid context in Pennsylvania. And lastly, but not leastly, not a word, we do policy advocacy to increase access to quality health care and services. And a lot of our advocacy lately has been around community health choices. So this is a significant part of our work, not only representing individuals with community health choices, issues and concerns, but we are in regular contact with the state when we hear issues of concern or if we have thoughts and ideas about ways of improving the program. So I just want to review what we're going to go over today so people know what to expect. I'm going to start out with a little level setting and explain the difference between Medicare and Medicaid. Then we're going to go into details about what community health choices is, some of the benefits, and then we're going to talk about how to get Medicaid waiver services through community health choices, which is really the big focus of the presentation. And that's going to cover not only getting the services, but how do you become eligible for the service? And lastly, we're going to cover appeals. We will be taking breaks for questions intermittently and then also at the end. As a reminder, for those of you who joined later, if you have questions, please put them in the Q&A box, not the chat box. We are saving the chat box for technical issues, and we're using the Q&A for question and answer. So before we go further, I want to do two quick polls to just get a sense of what people's experience is with some of the issues we're going to be talking about today. Kayla, can you pull up the first poll? Oh, and the second poll.
Yep, I just pulled up. Both questions should be viewable to all of our attendees. So feel free to vote as neat as you think. So the first question is, do you feel confident that you understand the differences between Medicaid and Medicare? And then that is a yes or no question. Give folks a little bit more time to do that one, and then we can move on to the second one. Okay, and then for the folks who have finished the first of the two questions, the second one is, what is your experience with Medicaid home and community-based service waiver programs? So those are HBBS waiver programs. And then there are a few options, such as I am in a waiver program, I have a family member in a waiver program, I have helped someone apply for a waiver, I am a waiver services provider, service coordinator, or work for a community health choices plan. I am familiar with Medicaid waivers, but don't fit into the categories above. And then lastly, I don't know what a Medicaid waiver is.
Which is okay, you will learn.
Which is Okay, and so just take the next minute or so to work through those 2 questions, and then we'll end polling and show the results. Okay, that seems to have slowed down, so I will end polling and share those results. Okay, Amy, can you see the results?
I cannot read them. I cannot see them. Can you read them if you have them?
Absolutely. So for the first question, which as a refresher was, do you feel confident that you understand the differences between Medicaid and Medicare? 59% of people voted yes, and 41% of people voted no. So 59% of our audience that voted feels confident that they understand the differences between Medicaid and Medicare. And then for the second question, which was, what is your experience with Medicaid home and community-based service waiver programs? The biggest percentage of people, 35%, said that they are familiar with Medicaid waivers but don't fit into the categories above. And then tied for second place with 18 and 19% is, I don't know what a Medicaid waiver is, and I have helped someone apply for a waiver. Ooh, actually, it's a 3-way tie, and I am a waiver services provider, service coordinator, or work for a community health choices plan. A very small percentage of people voted for, I have a family member in a waiver program, which was 6%, and then 2% of our audience that voted is in a waiver program.
Thank you for that, Kayla. I appreciate it. So,
sure.
So this helps me understand where we're going to go a little bit with the presentation, and never fear, I am going to explain briefly the difference between Medicare and Medicaid. First, I want to go over some terminology, though, just because you're going to see it on the slides and you're going to hear us use this terminology, some of which are acronyms. So CHC stands for Community Health Choices. That is Pennsylvania's newest way of delivering Medicaid through a managed care program, and we will talk much more about that. When you hear me or Susan say dual or dual eligible, we're referring to somebody who's enrolled in both Medicare and Medicaid, and that is possible. When you hear us see HCBS, or Home and Community-Based Services, that is a Medicaid service that helps people who are aging or have disabilities live at home and pursue goals for community integration. This is also called Medicaid Waiver Services. So a significant reason why Community Health Choices exists is to have managed care plans work on providing waiver services like personal assistance services, home adaptations, vehicle modifications, adult day living programs. There's a whole list of that you will see later, to people who want to avoid nursing home placement and be able to live and work in the community. Now, just so you know, when we're talking today, we're not talking about waivers through the Office of Developmental Programs. The waiver that is in the Community Health Choices program is through the Office of Long-Term Living. When you see LTSS, or long-term services and supports, that's an umbrella term that covers both home and community-based services and nursing facility services. And finally, we're going to talk briefly about a concept called nursing facility clinically eligible, or nursing facility clinical eligibility, which is NFCE. This is an eligibility standard that people need to meet in order to receive Medicaid-funded long-term services and supports through CHC. So somebody needs to be determined through an assessment to need the level of services of a nursing facility in order to get home and community-based services, or to get services in a nursing home. And this doesn't mean the person has to go to a nursing home. It's a little more nuanced than that. People who need the kind of support that would help them avoid a nursing home placement are the types of people who are eligible. And I'm going to pause here. Susan, did you want to add anything?
Well, so I am in that small percentage from that poll, and I'm a family member. So I am the mother of a 38-year-old gentleman who has cerebral palsy and is enrolled in Community Health Choices. And one of the things my fellow family members always ask is exactly what is nursing facility clinically eligible mean, because it's not a language that we typically use, and it's certainly not driven by the diagnosis. So Michael has cerebral palsy, and he is a wheelchair user and needs help with all activities of daily living. He has other friends who have cerebral palsy, one of whom, for example, walks, can feed himself, has a job, and he is actually, his friend is not nursing facility clinically eligible, but Michael is. And the crude way I explain it to my fellow mothers and fathers is by saying, if Michael didn't have the assistance that he gets from attendant care or from us, he would not live. So he would be eligible if my husband and I were to die tomorrow and Michael doesn't get services in his own home, he would be moved into a nursing home to provide all of the services that he needs in order to live a safe and independent life.
Thank you, Susan. Yes, and it's a kind of a nebulous term. What happens right now is the state uses a tool that is called a functional eligibility determination tool in order to assess whether somebody is considered nursing facility clinically eligible, and it looks at a number of factors. It's not this tool is not the be all and end all. They have, the definition sort of trumps it, but it looks at activities of daily living. It looks at cognitive and memory issues, people's ability to manage their medication. So there's a range of things that are looked at. And we at the Pennsylvania Health Law Project are involved in some of the appeals when somebody is denied eligibility based on a determination that they're not nursing facility clinically eligible. So you will hear this mentioned again. So now I'm going to talk about Medicare and Medicaid and give you a brief overview. And if you're wondering why we're talking about Medicare and Medicaid when this is a Medicaid training about community health choices, the fact is 94% of the people who are on community health choices have both Medicare and Medicaid. So it's really important to understand the difference and to understand how they work together. So let's start with Medicare. Medicare is federal health insurance primarily for people who are either age 65 or older, or who have been receiving Social Security Disability Insurance, SSD or SSDI, for 24 months. And this is a program that people get because they have paid into the system to get Medicare through their employment. So when we worked and you see the FICA is taken out of your paycheck, that's going towards your ability to get Medicare down the road and towards your eligibility. There are some people who get Medicare who haven't contributed, quote unquote, enough to the Medicare system, and they can get it because their income is low enough. But they still have to be 65 or older or receiving Social Security disability for 24 months. People, just as an aside, people who get SSI only don't get Social Security disability unless don't get Medicare unless they're over 65. And there are some people who get Social Security disability and Medicare even though they haven't worked, because they can get it based on their, the record of a parent who is eligible for Medicare and receiving Medicare. So there are two main ways that people get Medicare services. They can get it through original Medicare using the Medicare health insurance card that is pictured on the screen. It's a red, white, and blue card. And when they get it that way, they would also enroll in a Medicare prescription drug plan. So when someone says I have original Medicare or regular Medicare, that means the federal government is paying directly for their services. So they're not going through a health plan, except for the prescription drugs. The other way that people get Medicare is through private health plans called Medicare Advantage plans. And these usually, not always, but usually include prescription drug coverage. So in that case, it's the federal government is contracting with Medicare Advantage plans to provide all of the benefits of Medicare. And sometimes those plans will provide more benefits than original Medicare. But they also have restrictions on who you can see because they use a network, much like most people's private employer insurance. So you have to see doctors who are in the network. Okay, now I'm going to talk about Medicaid, and believe me, I will pause after this section is done for any questions. So Medicaid is also public health insurance, but it's public health insurance for people who are low income. There are different categories of Medicaid, and to be eligible, for almost every category except for disabled children, you need to have low income, and for many categories, you need to have limited resources. In Pennsylvania, we also will commonly call this medical assistance, or MA. And just like for Medicare, there are two main ways to get Medicaid services. Directly from the state using an access card. We call this fee-for-service Medicaid. So if you go to the doctor bills the state directly, and the state reimburses the doctor at whatever rate they've agreed to. But the other way to receive Medicaid, and the most common way in Pennsylvania, is through Medicaid managed care plans. This is a private managed care plan that the state contracts with, and they say, these are the Medicaid services. We want you, health plan, to provide the services to people who enroll. And so that managed care plan becomes sort of the gatekeeper for the services, but also the provider of all the services the state says are covered. And Community Health Choices is one of the types of Medicaid managed care plans. So I said 94% of people in Community Health Choices have both Medicare and Medicaid. These are, as I said earlier, dual eligibles. And for them, Medicare and Medicaid work together. So the rule is this: Medicare is going to be primary. It's going to pay first for any services it covers. And it doesn't matter whether somebody is in original Medicare or Medicare Advantage plan. Medicare pays before Medicaid for medical coverage, going to the doctor, going for physical therapy, for hospital coverage, and it pays prescription drug coverage. Okay? So Medicaid is last. It pays last. It's actually called the payer of last resort. And what it does is it wraps around Medicare in a way. It picks up any of the Medicare hospital or medical co-payments or co-insurance. So these are the amounts that somebody pays when they go to a provider. So if I go to a specialist, Medicare pays 80% of that. 20% is my responsibility, unless I have Medicaid, in which case Medicaid kicks in to pay what I would normally owe. And it also covers Medicare hospital and medical deductibles. So deductible is the amount that you have to pay for health coverage before your insurance even kicks in. So when I'm first, the beginning of the year, we always have a deductible in our health plans for those people who have them. And so what Medicaid does is it eliminates that deductible for people who have both Medicare and Medicaid. The other thing that Medicaid does for people who have both is it qualifies people to get extra help with Medicare prescription drug costs. So what this means is, if I'm on Medicaid and I'm on Medicare, I become eligible to enroll in a prescription drug plan that has no monthly premium, no amount I have to pay every month, and reduced copays. So the amount I pay for each drug is set based on whether it's a brand name drug or a generic drug. And then if my income is low enough, the state will also pay the monthly cost for me to even have Medicare in general for the medical insurance portion. Okay. There's one other thing really important that Medicaid does. It's not listed on the slide, but this is where Medicaid fills in the gaps for services that Medicare doesn't cover. So there are some services you are not going to be able to get through Medicare because they're simply not covered, but Medicaid will do that. Medicaid covers transportation that's medical, so if somebody needs transportation to and from a provider's office, that's covered by Medicaid. It also covers over-the-counter medications. Doctor can write a prescription, for example, for baby aspirin that somebody might need to control heart disease. Medicaid will cover that, even though Medicare won't. It also covers things like incontinence supplies, and very important for people who are on the waiver, it covers long-term services and supports. So waiver services and nursing home services. The services like personal assistance, a home health aide, nurses in the home. The only way to get that in most circumstances is through Medicaid. Medicare covers a very limited home care benefit and a very short-term nursing home benefit. So I'm going to pause here for questions. Pam, do we have a few questions that have come in? Maybe you can answer some?
Sure, we do have a few questions. Can everyone hear me okay?
Yep.
Hi.
Yes.
This is Pam Silver from Pennsylvania Health Law Project. I work with Amy, and I am fielding the Q&A box today. The first question was from Bhavani Gautam, and she's asking, why would someone be eligible for Medicare Part B and Part D, but not be eligible or not have Part A?
Okay, so we didn't get into this, but Medicare has parts. Medicare A is hospital insurance. Medicare B is medical insurance, so the regular sort of going to the doctor. Medicare D is prescription drug coverage. And then you're wondering where C is. C is just a holding place for Medicare Advantage plans. So it's not the case that somebody would not be eligible for Medicare Part A if they're eligible for B and D. But there are some people who do not have sufficient work history, so they haven't paid into the Medicare system sufficiently, that they don't get to have Medicare Part A for free. They would have to pay a monthly premium to get that Medicare A hospital insurance. But if their incomes are low enough, the state will buy them into the Medicare A insurance. Do you have any other questions?
Yes, there were. Thank you for that, Amy. The next question is from Teresa Smith. she says, I thought that someone who's currently enrolled in an ODP waiver could consider switching to CHC depending on the services they may be in need of. I know they cannot be enrolled in both, but I know some of our ODP waiver individuals who have gone into nursing facility and then got switched over to CHC. Can you explain that? Or do you want to hold that?
Let's wait on that one. Yeah, we'll hold that one.
Okay. Anna Santoyo asked, what is the income assets criteria for Medicaid versus Medicaid waiver? The short answer to that is it depends. There's a bunch of different categories of Medicaid, and they all have their own income limits and resource limits, and they all have their own different ways of counting them. And there's some categories that don't count resources at all. So for regular Medicaid, there's not a simple answer to what is the income limit. The current income limit for waiver services is $2,349 a month. That's linked to the federal poverty level. And there's a resource limit of $8,000, but there are spousal empowerment provisions which can affect how those assets are counted when you have a spouse. So if you've got a spouse, some of your assets might be shielded for purposes of your waiver eligibility. Okay.
Are there any more Medicare or Medicaid questions at this point? And then we can save the ones that are related to other issues for later on.
No, none of the other questions that are up right now have to do with Medicare and Medicaid.
Okay, so let's move on and maybe we can address whether if they're not answered as we go on. Okay, so now we're going to get to the real question, which is, what is community health choices? So really, community health choices is not changing Medicaid so much as changing how people get Medicaid. And it's a delivery system for the services for certain adults, so 21 or older, who are in a target population, which I will explain in a minute. So it's administered by the Pennsylvania Office of Long-Term Living. And if somebody is eligible for community health choices, they have to join a managed care plan to get their Medicaid services. So anybody who's in the target population for this program, if they want to get their Medicaid, they're going to have to join a community health choices managed care plan. It does not exist in that fee-for-service setting. And what the people, once somebody's enrolled in CHC, they use their plan card to get their Medicaid physical health services, their Medicaid home and community-based services if they're eligible, and Medicaid nursing home services if they're eligible. So remember what I said earlier, you have to be determined by the state to be nursing facility clinically eligible. You have to meet this, there's a clinical eligibility standard to get the home and community-based services and the nursing home services. So there are some people in community health choices who are just getting the physical health services part of CHC, and other people who are adding on top of that home and community-based services or nursing home. Critical thing to know, though, is CHC does not affect Medicare. It doesn't change the Medicare, it doesn't change how you get Medicare. Medicare is unaffected. The only relationship it has to Medicare is that it wraps around the Medicare benefit. So, who has to enroll if they're eligible? And there's a little bit of an exception here, but if somebody is age 21 and older, so remember this is not for children and not for young adults, and they're in one of the following groups, they have to enroll. So if they're dual eligible, most people who are on Medicare and Medicaid have to enroll in community health choices if they want to keep getting Medicaid. If the person's determined eligible for the community health choices home and community-based services waiver, the way they're going to get their waiver services is through community health choices. Now, community health choices is statewide as of January 1st of this year. It was rolled out in 3 phases, so every year more and more counties came online. And what it did in terms of the waiver services for people who needed things like personal assistance services is it replaced some of the existing Office of Long-Term Living waivers. So at this point, the aging waiver, the attendant care waiver, the independence waivers, and the ComCare waivers no longer exist in Pennsylvania. Anybody who was in those waivers has been moved to Community Health Choices. And anybody who would want to be in those waivers would now apply for Community Health Choices waiver instead. Also, a substantial number of people who were in the OBRA waiver are also now in the Community Health Choices waiver. There is a small segment of people who are not in Community Health Choices and still getting OBRA services. These are people who don't meet the nursing facility clinical eligibility requirement. And finally, the third group of people who are in CHC are residents of nursing homes. So if somebody is going to be a long-term resident of a nursing home, they are placed into Community Health Choices. But of course, there are exceptions because there's always exceptions in Medicaid. So there are some people who do not have to enroll in Community Health Choices. And this is true even if they're those dual eligibles, so that they're on Medicare and Medicaid. If somebody is in an Office of Developmental Program waiver or is receiving base services from the County Intellectual Disability Office, they do not have to enroll in Community Health Choices. So the waivers I'm talking about are the Consolidated Person Family Directed Supports Community Living waivers, as well as the autism waivers. So there was a question earlier about what happens, don't people have a choice if they're getting services in an ODP waiver? The short answer is yes. So it's just because somebody has a developmental disability or an intellectual disability doesn't necessarily mean they are getting waiver services through the Office of Developmental Programs. They might be on a wait list to get those services, or they might be getting some services through the County Intellectual Disability Office, but not as many services as they really need. So in some cases, people make a decision. It should be a well thought out decision to go into Community Health Choices, which does not have a wait list, in order to get services. Now, the services are different. There are some that are the same, so the people can get in-home nursing and some of those services, but it's not necessarily the same services because Community Health Choices was not designed with people with intellectual disabilities or developmental disabilities in mind. So, whereas the ODP waivers were. So you're not necessarily going to get the services that support people who have intellectual or developmental disabilities specifically. So it's a choice that we suggest people really think about. When somebody gets Community Health Choices, it usually means they're not as much of a priority to get on an ODP waiver because they're having their needs met. And the wait list for ODP waivers isn't really a list of like 1 to 100. It's a list that shifts based on people who have needs that are unmet. Susan, did you want to add anything to that?
I don't think so, because I'm going to deal with it in the next couple of slides. Thank you.
Just checking in.
Thank you.
Okay. So the next group of people who are not mandated into Community Health Choices are, as I said earlier, people who are on the OBRA waiver, but who are not nursing facility clinically eligible. So there's some people whose needs are not that high because OBRA traditionally didn't have a nursing facility clinical eligibility requirement. Also, people in state-operated nursing facilities or veterans' homes don't enroll. And the other thing is people who are in LIFE programs. So a LIFE program stands for Living Independence for the Elderly, provides long-term services and supports to people who are 55 or older. And there are LIFE programs in a lot of different geographic areas, but they're not in every county in the state. So there has to be one in somebody's area to join. And really, they combine Medicare and Medicaid. You don't have to be on Medicare to be in it. So it is actually an alternative to CHC. So if somebody needs home and community-based services, they want supports in their home or they want supports to help them live in the community, they can choose between going to a life program or going to community health choices. And when somebody's in a life program, they have to use the life providers or providers that are in the life programs network. And they generally access healthcare and other services at a life community site.
Amy, I would like to, before you go to the next slide, there is something now that you finished this one that I wanted to double check with people. Oftentimes we hear that someone has a developmental disability, and they assume, whoever we're talking to, perhaps a service coordinator or a provider or even a family member, that that means programs that are supported by one office or the other, like either the Office of Developmental Programs or the Office of Long-Term Living. And again, everyone should remember that the term developmental disability means that any disability that occurs prior to the age of 22. So it could in fact mean someone who has an intellectual disability or autism or cerebral palsy or a spinal cord injury or spina bifida. So the term developmental disability only gives you one set of information, and that is that age of onset. It doesn't tell you enough about the disability. So there is often a great deal of confusion. They will say, well, my child has a developmental disability. And when they're calling PATF and we're trying to help them figure out what services someone may be entitled to, the next question is, well, tell us a little bit more about your child. Because if you have an intellectual disability, for example, you may want to go directly over to the Office of Developmental Programs, but sometimes you'll get people who also have cerebral palsy, and given that there is a waiting list for many people who are not like transitioning from school, you may want to consider, as Amy said, community health choices. So I just want to make sure people understand what that term developmental disabilities means, and that it does not give you really enough information to know where you should begin.
Thank you, Susan. So now we're going to actually, I'm going to put a different slide up, but we're going to go to our third quick poll. This is quicker than the last one. Kayla?
Yeah. Watch it. Okay. So it's a true or false question. And it's true or false. The Office of Developmental Programs, ODP waivers, are part of community health choices. I'm hearing that maybe some folks can't see the poll, which is very odd. Okay, I'm going to stop. Okay, nobody got the poll. Let's try this again.
It came up just now.
Okay, people can see the poll now. Great. So again, that's a true or false. The ODP waivers are part of community health choices. Okay. Folks are still voting up a storm, and it's tapering off. Okay, so let's end that. Okay, so hopefully everyone can see the results, but just in case our panelists can't, 87% of our audience voted that it was false.
Okay, excellent. So just as a reminder, the Office of Developmental Program waivers are separate from the Community Health Choices waivers. Community Health Choices waivers are administered by the Office of Long-Term Living, and the waivers, the Consolidated Person Family Directed Supports, Community Living, Autism waivers are all in the Office of Developmental Programs. So if you are in an ODP waiver or you know someone in an ODP waiver, then Community Health Choices has nothing to do with it. Okay, so just to wrap up, and then I'm going to take a few more questions. I've talked a little bit about Community Health Choices and how you have to pick a plan in order to get the services, including the waiver services if eligible. There are 3 plans in Pennsylvania. There's Keystone First Community Health Choices, which that's in the southeast. It's called Keystone First. In the rest of the state, it's called AmeriHealth Caritas. There's PA Health and Wellness, and there's UPMC Community Health Choices. These are the only 3 options. So we have 3 plans. So don't ask about Aetna or United. They do not have Community Health Choices plans. They have some regular Medicaid plans, but not the kind where people get long-term services and supports. The Community Health Choices is the only option if somebody wants to get the waiver services we are going to discuss. So when somebody's in a Community Health Choices plan, the plan develops provider networks, but they all offer the same benefit package. So they can restrict you to seeing certain providers. They offer the same benefit package. I want to make one little note though. For people who are on Medicare and Medicaid, so they have to be on Medicare, if you have a provider that's not enrolled with your CHC plan, and it's your Medicare provider, say your primary care doctor, the Community Health Choices plan will still pay the Medicaid portion of the bill to that doctor. So the Community Health Choices plan is still going to pay my doctor, even if my doctor is not enrolled in, say, UPMC Community Health Choices, because that's a way of being able to give people more access to see their providers. There are some complications around that. So if you have issues, or you know someone with issues where the provider's saying, well, I don't care, I don't want to have to deal with that Community Health Choices plan, sometimes it's really a matter of educating the providers on the fact that they can and will get paid. And we field calls like that all the time. So I'm going to pause again for a couple more questions before we move on.
Hi, Amy. Yes, we do have some more questions. So one question one question comes from Catherine Nold. She asked whether nursing home services include group homes. I think you're going to touch on that a little later in your presentation when you talk about the different services covered by CHC, correct?
Well, the short answer is no, group homes are not considered nursing home services. So if you're talking about the group home settings that are in the ODP waiver, that is something that ODP covers. They're not group homes in Community Health Choices.
Thank you. Catherine Nold also asked, does the developmental disability include blindness onset before age 22?
Yes.
Yes, it's any disability or any that for which the onset is before 22. So if somebody, it doesn't mean that they've developed it when they were really young necessarily or at birth. Somebody who has a traumatic brain injury when they're 18 that is affecting them could be considered as having a developmental disability as well for purposes of the program through the Office of Developmental Programs.
Okay. And then Teresa Smith asked a follow-up question about some individuals they've had who are enrolled in an ODP waiver, then go into a nursing facility for rehab. And then while they're in the nursing facility, somehow they get switched over to CHC without anyone being notified. And they usually don't find out until they're ready to be discharged. How would someone be switched from an ODP waiver into CHC while they're in a nursing facility without the individual being notified?
So that's actually an interesting question that I would like to have a longer conversation about. My email is on the beginning of the slides, because I had not heard of that happening before. I think it's very concerning if somebody loses their slot in an ODP waiver because they're in a nursing home for rehab. So I think it's something we need to explore further.
Okay. Cheryl Corey asked, if a person over 21 has an intellectual disability diagnosis and chooses to stay with in an ODP waiver and not join CHC, how does ODP provide the Medicaid services? The short answer to that is that those folks would, I believe they would continue to get the Medicaid physical health services through a HealthChoices plan. And then the waiver services would be carved out separately. So the waiver services would be handled separately from the rest of their physical health benefits. One of the goals of Community Health Choices was to bring the physical health benefits and the waiver services all under the same umbrella and under the same plan.
Thanks, Pam. We're gonna move on, and we're gonna to the next section. So
okay,
Susan,
I'll continue answering questions.
We're going to talk a little bit about benefits.
Great. Just wanted to make sure that to answer another question that came in, if you have a traumatic brain injury, like using the example Amy gave, say you're 16 or 18 years old and you have a traumatic brain injury, and you, in the past, you would have gone right in, you could have gone at 18 or 21, you could have gone into the ComCare waiver. Now you would be going into Community Health Choices. So again, you need to know more than just the diagnosis, because quite a few people who had traumatic brain injury never entered into the ODP world. They were in the Office of Long-Term Living world and have gone right into Community Health Choices. So again, it's, keep teasing down beyond the diagnosis, what are someone's needs? So going into the next slide, it's Community Health Choices, the benefits package. And I hope you all are amused. On the right-hand side, you will see a cheesesteak. That was Pam's idea. So what exactly is the Community Health Choices benefits package? And one of the things that I personally find kind of amusing is once the state finds a phrase they like, they use it multiple times in multiple settings. Just like Access, you have the Access card, and it's also a school program for children with disabilities. Community Health Choices is the same thing. Community Health Choices is a regular program that for people who are on Medicare and Medicaid getting their physical health benefits, Medicaid benefits. I should say it's Medicaid physical health. On top of that, if you meet those criteria, functional limitations and financial limitations, then you will also be eligible if you sign up for the Community Health Choices waiver program. So I hope I didn't confuse everyone with that, but Community Health Choices is all by itself. It has physical health benefits. The waiver program is on top of that, and you must sign up for it. So what do you get from it? You get all of the physical health, and you get the broad waiver package that is offered by all three of the managed care organizations that Amy just mentioned, which are Keystone First, AmeriHealth, UPMC, and Pennsylvania Health and Wellness. And everybody, whether you're in a nursing home or living in the community, you get service coordination. So you get this robust package of benefits and services. And then each of the 3 MCOs, managed care organizations, have a different added benefits package. So what I would do if you're really curious, and we list this resource later on, is if you look on the Office of Long-Term Living website and you go CHC enroll, you can compare each of the plans. You can compare 1 to 2 to all 3. But anyway, the next slide is really, as you can imagine, coming from PATF, we can talk about our beloved assistive technology. And we created this infographic that is available. If you go on PATF's website, you can download it as an infographic that you can post in your office or put in your folder so you'll remember it. We even have some posters that we were able to disseminate in some of our in-person trainings, and we will be disseminating them in the future. But the purpose of this infographic is to say the Community Health Choices waiver program offers a lot of benefits, more than just health care. It provides, and you'll see on this chart, nursing home transition services, helping someone who would like to move out of a nursing home to get back into the community. It provides hearing aids, and there are rules. So you have to go to an ear, nose, and throat doctor, and they will help refer you. But you, for once in the last several years, you haven't been able to get hearing aids. Particularly for our seniors, this is important. Durable medical equipment, smart home technology. Again, this falls under the umbrella of assistive technology, but what I always enjoy is digging deeper into these waiver languages. Smart home technology is defined as electronic devices. Cognitive and behavioral therapy, vehicle adaptations, that means lowered floor, ramps, tie-downs, hand controls, things like that. Occupational, physical, speech therapies, pest eradication. This is a new service, and by the way, very much needed, and it looks like trying to find companies that will do pest eradication. They know they have to come back twice, that some of the MCOs are now working on a broker model. Transportation, non-medical. This is important if you're really talking about community integration. Job coaching, basic assistive technology, meaning switches, all of those kind of things, including grab bars, by the way. Grab bars are viewed under Medicare as a convenience item, so Medicare would not pay for them, but the waiver will, if that's what you need. Home adaptations, and of course that means widened doorways, ramps, roll-in showers, lowered kitchen counters. Right now, they're counting ceiling lifts as home modifications, but of course we know that's durable medical, personal assistance services, and there's so much more. So I'm hoping that with this discussion, you will use your imagination and try to figure out how best people with disabilities and seniors can be supported in the community so they're really living quite a rich life. I think we have a poll, right, at this point?
We do. So I'm going to launch it, and hopefully it works. You should be able to see it. There may be a slight delay. Oh, people are voting, so people can see it. That's great. I'll just wait until the voting dies down a little bit.
So do you want to read it for people who may have trouble seeing it?
Yes. Thank you for reminding me, Susan. I'm just so excited that everyone can see it that I got overwhelmed. Have you experienced a barrier in getting assistive technology, home modifications, or vehicle modifications through Community Health Choices? If yes, please share your experience in the chat box. Okay, and I think the bulk of the responses are in, and 87% of the people who voted said no. They have not experienced a barrier in getting assistive technology, home modifications, or vehicle modifications through CHC. 12% have said yes, and I urge them to share their experiences in the chat box.
Fabulous, and thank you, and I hope those of you who've been trying to help people get assistive technology will in fact help us with their experiences. We know that there are problems, particularly with coding, how a provider would enter in the code and request it, so we're working with the Office of Long-Term Living on that. And other issues are just finding contractors and other vendors who are because these people have to be Medicaid providers, and then be enrolled in the Community Health Choices plan. So be enrolled within Keystone First, AmeriHealth, the UPMC, and Pennsylvania Health and Wellness. So it gets a little tricky, but it's not insurmountable. Okay, the next slide, please. Here's an important role for all of the waiver participants. People get service coordination. Now, what I do want to say is there's, as a parent I'm saying this, there was a new world order under Community Health Choices. Previous to Community Health Choices, our service coordinating entity was an independent entity. This is no more. Service coordinators have a contract with the managed care organization. They are directly employed, as you will see in this slide, by the managed care organization. So they're working together, but it does mean there is no longer an independent ombudsman. So one of the things that's important for people to know is if it's not working well for you, to call the participant line with the Office of Long-Term Living, because the Office of Long-Term Living will not know if there are unintended barriers until people get in touch with them. They're hoping that people are getting better training that they had before, that there's greater consistency, but frankly, as a parent, I like having an independent entity. But anyway, I digress. The service coordinator responsibilities are to identify the needed services both inside and outside of the waiver. So some things the waiver won't cover, but the service coordinator is supposed to help you identify those things and give you some advice as to how you can obtain them. Coordinate the services within the home and community-based services, nursing facility, all of your doctors, including the behavioral health plan. I want to really point out that there's supposed to be greater coordination, and that the participant gets their services that meet their needs with their preferences, and the service coordinator is facilitating the person-centered service planning process. Who provides these services? As I said before, it's the Community Health Choices plan. So you can get the service coordinator within the plan, or all of these plans have subcontracted with several other agencies. I know in the Southeast, for example, in one of the plans, there are only 3 or 4 independent agencies that are not Keystone First, for example, or UPMC, or Pennsylvania Health and Wellness. So people do have an option. They have an option of going towards an agency that has a contract with the plan, or going directly in the plan. Did you want to say anything about this, Amy?
Just briefly, so we are going to talk a little bit about what person-centered service planning is, and I apologize if you can hear my dog in the background. Work from home. But the service coordinator really has a critical function because they're the person who is going to help people access all of their services. And we have had people have difficulty getting a hold of their service coordinators, and that shouldn't be happening. So if it is, we encourage people to file complaints if they're unhappy with their service coordinator. You do not have to stay with your service coordinator. You can ask for a new one and should be given some options about who that person will be. But we encourage people to file complaints when they're really having problems because that's how the plans will know that there are issues. And it's also how the Office of Long-Term Living, which oversees the program, will know if there are issues. So complaints are important. There is one plan that you have to specifically say, no, I want to file a formal complaint, otherwise it's done informally. So I encourage you to make it formal. That puts the Office of Long-Term Living on notice. It's actually more fair to the other plans so that, you know, we can see what's going on behind the scenes and what types of issues people are raising.
Right. And I guess what Amy said is really important for everyone to understand. It's the key to getting any of these services and benefits is working with your service coordinator. And so having a service coordinator who is able to help you and communicate with you the way you want to be communicated with is critically important. And by the way, I know this is kind of the ideal, so I might add a few hours, but if you contact a service coordinator, they're supposed to be back in touch with you within 24 hours. And that's not 24 working hours, that's 24 day hours. So maybe given what's going on right now, we could give them a few more hours, but as a parent, I'm holding true to that 24 hours. Okay, next. So as we've both mentioned, everybody gets the same basic services, and then the 3 plans, they have added benefits. And again, you can find those under www.enrollchc.com and then choose compare plans. For example, if you'll see on this slide, the managed care organizations do things a little bit differently around dental, vision, phone services, wellness programs, and they're there to kind of entice you to come with them. So I think it really is quite important that people look at those plans and compare them and see what works best for them, not just for who is most popular in their area. So as we all know, UPMC has a huge presence out in the western part of the state. They were well known, and much less presence here in the southeastern part of Pennsylvania, whereas southeastern Pennsylvania had a much bigger presence of Keystone First, AmeriHealth, but only known as Keystone First in southeastern Pennsylvania. But compare the 3 plans because their added benefits are there to help people live a better, healthier, more independent lifestyle, and that information is, in fact, updated on the website that you'll see at the bottom, www.enrollchc.com/choose/compare-plans. Thank you.
And I want to just jump in really quickly here. So we do have on the slides the current comparison of the benefits that I pasted in. For those of you who cannot see the slides, I did send this out earlier. I have a text version of this that we can send around, and the link does allow you to do the comparisons. So I think we're going to pause to see if a couple more questions have come in. Pam?
Yes, we've been getting a lot of questions, and I'm going to group these into categories because I'm getting people asking similar questions. First of all, a couple people had questions about aligned Medicare Advantage plans. So Jessica Fenton asked that she recently had a patient who was enrolled in Allwell Medicare Advantage, previously had original Medicare and CHC. And then Stephanie Lowry mentioned she is a client who's dual eligible, enrolled in Keystone First Community Health Choices, and then to increase his benefit, she was going to enroll him in Keystone First VIP. So her question was, will dual enrollment in VIP Health Choices disenroll him in General Keystone First CHC? And Jessica wanted to know if this is a trend or if this will be required. So Amy, can you talk a little more about the aligned DSNPs and aligned Medicare Advantage plans?
Sure. So an aligned plan in this context means that the Community Health Choices plans, the 3 Community Health Choices plans, each have to have a Medicare Advantage plan specifically designed for people who are dual eligible as well. So Allwell, which was mentioned by Pam, is the Medicare Advantage plan that aligns with PA Health and Wellness's Community Health Choices plan. The idea behind having aligned plans is to allow people, the hope really, the hope behind this is that if one company is overseeing both the Medicare and the Medicaid benefits, then services will be better coordinated. There is no requirement that people join the aligned Medicare Advantage plan that goes with their Community Health Choices plan, or that they join any Medicare Advantage plan. They can just stick with original Medicare. Right now, we do not have enough evidence to say whether this alignment of plans will do what the hope is, which is to improve health outcomes, improve coordination. So really, when people are looking at Medicare Advantage plans, they should be looking to see, are the person's preferred providers in the network? Are their prescription drugs covered by the plan? What are the other, because the Medicare Advantage plans have some added benefits, what are the other benefits that are offered through the plan? So that's what you want to look at. You want to kind of make the same decisions that you would make for any plan choice, which is, can I see my doctors? Are my prescriptions covered? What benefit am I going to get from this? Just because you join a Medicare Advantage plan doesn't mean you get disenrolled. So somebody can be in Keystone's Medicare Advantage plan, but in UPMC's Community Health Choices plan. You don't have to be in an aligned plan.
Thanks, Amy. Diana McCord wanted to know whether people in the Act 150 program, whether they go into CHC.
No, Act 150 is completely separate from Community Health Choices.
Okay. Alrighty, Kimberly Moyer, Melissa Good, and Loretta Swink all wanted to know more about how does a person in CHC find out who their service coordinator is? Is there a way to find out who the service coordinator is? And how long till when they're first enrolled in CHC, how long should it be before they hear from a service coordinator?
Okay, so I'm going to answer, this is going to be the last question for now. This doesn't mean we're not going to try to answer questions even when this is over or after the presentation, but so people should be contacted by their service coordinator so that they know who they are. That said, we have heard a lot of issues of people having no idea who they are. A call to the health plan should resolve that. If it doesn't, you should make a complaint. I mean, this is like, because we are hearing a lot of issues of people who just don't know who their service coordinator is, or some who have been told that they don't have one assigned, which should never happen. You do have a service coordinator choice. So if you decide you want to take some time to make a choice, that could delay getting a service coordinator assigned. But you could also say, hey, just give me somebody and then I'll decide later whether I want to keep them or I'll make my decision in the meantime. So just to clarify, service coordination is available for people who are getting home and community-based services. So it's not every CHC enrollee. If you're just getting regular Medicaid benefits and you're not in a nursing home or not getting home and community-based services, you will not automatically have a service coordinator. There is some flexibility to provide case management for people who need it, who don't otherwise get long-term services and supports, but for the most part, only the waiver recipients and nursing home residents have a service coordinator. When somebody is joining CHC to get waiver services, whether they're supposed to have a comprehensive needs assessment within the first 5 days of joining that plan. So the service coordinator should be in touch very quickly.
Thank you, Amy.
Okay, I think we're going to move on. And my dog is just out of control, so apologies. This will be memorialized forever on the recording. So I'm going to talk a little bit about how to get waiver services, and then Susan's going, we're going to sort of share this section. I'm going to start with the beginning. I want to just remind people again that if you want home and community-based services and you're already on Community Health Choices, but not approved to get waiver services, you still need to apply to get them. Okay, so there's a two-phase process for getting waiver services. Phase one is the eligibility determination, and this consists of a clinical eligibility assessment plus a financial review. And the phase two is service planning. So this is actually after you've been approved for getting waiver services. Then you get a comprehensive needs assessment by the Community Health Choices Plan through the service coordinator and a person-centered service plan. So phase one is the clinical and financial eligibility. As I said earlier, you must be nursing facility clinically eligible, and this is assessed using a functional eligibility determination, or an FED, a FED we call it. I mentioned this earlier. It's a tool that sort of serves as a proxy for saying whether you meet the standard of somebody who, if they don't get enough services to support them with activities of daily living, or they have cognitive issues, then eventually they're going to need nursing home care sooner rather than later. So that's really the standard. The other thing that must happen is a doctor, the person's doctor, must complete a physician certification stating that the person's nursing facility clinically eligible. We have seen a lot of issues. Doctors are very busy. We've seen the form filled out incorrectly, the form not signed. Sometimes the doctors don't get the form, but usually there's an issue with how it's filled out. If the form is not filled out correctly, for the most part, the person's going to be denied eligibility for the waiver. So it's really important to make sure the doctor's on top of this and understands, and that the doctor understands that, like, even though they don't think that their patient needs to be in a nursing home right now, that they understand it's a little less severe. The person doesn't have to have skilled needs, like a need for a nurse or physical therapy.
Amy, can I just add one thing here? This is different language, by the way, than most physicians use. So it's really confusing. And so what we recommend, if we're helping someone get into a waiver, we always ask, say, please follow up with your doctor. Let them know this form is coming and how important it is that they fill it out and sign it and send it back, and that please click off the nursing home, the NFCE. and it's very confusing. So like Michael, for years, he's never lived in a nursing home, but he does qualify for being eligible for that kind of a placement. And his doctor even most recently said, but he's doing so well in his own home. And it's only because it's a different language than what they're used to, but I would definitely follow up. That's where so many things fall through the cracks, is getting that letter filled out completely and accurately and returned.
Thanks, Susan. That's really helpful. So now we're going to talk about the second phase. So if somebody makes it through and is found clinically eligible, then they're going to go through and be determined whether they're financially eligible. So for the waiver, there's a much higher income limit than most Medicaid programs. The maximum income monthly is $2,349 per month. This changes every year, and it only looks at the applicant's income. So there's no spousal income that's considered here. The resource limit is also higher than other Medicaid programs that have resource limits for the most part. It's $8,000 a month, and it can be even higher if someone's married, because they actually sort of assume that some of those resources are being used by the spouse. I'm not going to get into how you calculate the resources for a married couple. It's kind of complicated, but it can be significantly higher. So resources, when I talk about income and I talk about resources, I'm talking about countable income and resources. So some resources don't count. Some people with disabilities have what's called an ABLE account, which is an account set aside with money to be able to use to support them living in the community. Some people have money in a qualified special needs trust. Those things don't count. Some people have an IRA, but what counts for the IRA is the amount they would get if they withdrew it, not all the penalties and taxes. So it can be complicated, and if people are on the edge, they should definitely ask questions. The other thing to know is there is no resource limit if the person has children under 21 living with them. Finally, when somebody is doing an application, they should be prepared to provide 5 years of bank statements or other resource information, because when the Medicaid program looks at resources, they also go back to make sure that people haven't given away their resources in order to become eligible for long-term Medicaid services. So that can be very onerous to find those 5 years worth of bank statements. So we always advise people to be prepared to have them and be in communication with their banks, because the county assistance offices will be looking at that. Okay, so this slide is sort of a very broad brush overview of the process. It can take a while to get through the whole process from application to a final decision about eligibility. It's many steps. Generally, the rule of thumb is it can take about 90 days, and there is no system to get home and community-based services like personal assistance services before you're eligible. So you have to go through the process. So it starts with the applicant initiating the waiver process by calling the independent enrollment broker. That's also an entity called Maximus at 877-550-4227, or completing a Medicaid application, seeking the waiver and submitting it. That kind of triggers the independent enrollment broker, Maximus, to come out to someone's home and do a home visit. At the home visit, they explain the process. They help the person, if they haven't done so already, with the Medicaid financial application. And they talk to the person about what they're going to have to do if they are fund eligible, which is choose a CHC plan. Then Maximus, the independent enrollment broker, requests the physician certification that Susan and I were discussing, and requests that functional eligibility determination. They then ask Aging Well, which is usually one of the area agencies on aging in the county, to come out and do another home visit to perform a functional eligibility determination. This is an assessment, as we said, of whether the person meets the clinical eligibility, nursing facility clinically eligible. if the person is found ineligible at this point, they will get a notice with appeal rights, and they should review that notice and file an appeal if they think the decision is wrong. If they're eligible, they don't hear anything, and it goes to the county assistance office, who then reaches out to talk about getting the look-back documents, so the bank statements, and make a financial eligibility determination. So you can see it's a really long process, and people can get lost in the process if they don't stay on top of it. So if you know someone who's going through it, helping them through it is pretty important. The other thing I just want to mention is right now, because of COVID-19, the in-home visits and assessments are not happening. They're happening over the phone. And that means that if somebody doesn't have eyes on, especially for that functional eligibility determination done by Aging Well, you want to make sure that the person who's being assessed for the waiver talks about anything that the Aging Well assessor isn't going to be able to see that they normally would. So, you know, it might be something like, if you came to my home, you would see that I can't get out of my bed. I'm in my bed, and I've been in my bed, and the only way to get out is with assistance, and I'm not able to shower. I have to take a sponge bath. So describing physically, or the bathroom's upstairs, I can't get to it on my own. I have to crawl up the stairs and I fell. So just giving the kind of information that the assessor would normally be able to see. Okay, Susan, do you want to talk a little bit about phase 2?
Yes, so phase 2, and I'll be fairly brief so that we can get on to that next section, is once someone has been approved for community health choices, the next stage is kind of exciting but critically important. And the service coordinator, and again, as Amy said, and we can have questions at the end, the service coordinator is going to be in touch with the waiver participant to set up a time to do the very, very comprehensive needs assessment. And right now, because of the coronavirus, these are all being done on the telephone. But in general, if we didn't have this crisis, they'd be done in person. It is incredibly important that every person, a waiver participant, have an advocate with them. This isn't something that the Health Law Project is espousing. This is our experience at PATF and my experience as a parent, because the questions are very detail-oriented, and you're supposed to be thinking broadly. And through this very comprehensive needs assessment comes your person-centered service plan. So being able to very robustly and completely talk about your health care, what it is you currently do, what it is you would like to do. So what are your goals? What's needed to meet those goals? All of that is discussed in this needs assessment. So for example, I will explain one place that we helped someone. They were in the aging waiver, going into the aging waiver a year or so ago. So they would be coming into Community Health Choices now. And the question was asked, well, are you able to kind of manage your medications? And the woman said, yes, all by her, yes, I can do that. Well, I happened to be there observing, and behind her, she had a huge Costco container that used to have pretzels in it, and it was filled with medication bottles. And her friend who lived next door said, no, you don't do that by yourself. I come over every other day and put your medications in this little container of Monday, Tuesday, Wednesday, AM, PM. So that's just an example of why this is a critical step of getting the services someone needs, and it's just best to have an advocate, whether it's your friend, your family member, your next door neighbor, someone who knows you well should be there. And then from that comprehensive needs assessment comes your service plan. And as you'll see on the slide, It's holistic. It should talk about needs and goals and outcomes and what services will be implemented and put in place so that you can meet those goals. And remember, in the waiver, obviously it's improved health outcomes, safety, but also independence. Next slide. So what do you do if your needs change or your new services are needed? Every year, you are guaranteed at least at a minimum an annual reassessment, and a new assessment is required after a trigger event. So a significant change in your health, change in caregivers, and hospitalizations. So our son Michael, for example, a couple of years ago went through a series of operations because of his spasticity, and every single time kind of new services, new health, new nursing services would be needed, and then they could drop off. But that triggers a new assessment, and if new and different services are needed, the trick is to talk to your service coordinator. So for an example of how quickly this can happen, because of the coronavirus, we know of several people who are no longer able to go out to the grocery store. And their attendants are anxious and they're changing. Like one person we talked to, their main attendant tested positive for the virus, so they're no longer working. So the question was, how are they going to be able to eat, go shopping, and eat healthfully? Well, the service coordinator suggested home-delivered meals. These people were anxious about that, like they like to have their own food and blah, blah, blah. So the service coordinator sent over a menu for one company, and they had a choice. They tried out them, and within a week of just letting the service coordinator know that they were now really concerned about how they were going to eat, they now have home-delivered meals during this crisis. The key really is looking at your needs, justifying those needs, and being in touch with your service coordinator. Okay, next.
Okay, I'm going to make a quick comment here because of the COVID-19 crisis. So right now, everybody who is getting home and community-based services should be getting an outreach from their service coordinator to go over any of their backup plans for care to make sure the backup plan is realistic and to modify it if it isn't, because there's a lot of concern that there's going to be more and more call-outs as this virus spreads. And so that's something that should be happening. The other thing is, if people were getting adult daily living, some people were going to adult day centers or even senior centers, and they're now home, they should reach out to their service coordinators, who should have reached out already, and say, I need assistance, I have a gap in my care. So if there's any gaps caused by this, you need to make sure people are reaching out and making the service coordinators aware of those gaps so that they can address them. Because this is, right now it's seeming like it's only going to get worse. We're not we're not through the thick of it. Okay, so I'm going to talk about appeals in community health choices. And an appeal is how you challenge a decision that you disagree with that is made by your community health choices plan. And I want to say something generally, which is service coordinators, even if they work for an outside entity, they're making decisions for the plan as well. So if a service coordinator tells you that you can't have a service you request, that is a decision that is made by the plan. Service coordinators are performing an administrative function of the Community Health Choices plan. So those are appealable decisions. Will you get a notice about them? Not necessarily, and we'll talk a little bit more about that. Okay, so I'm going to talk about what types of decisions can be appealed. And in Pennsylvania, it's a little weird. We have two different names for an appeal. Some appeals are classified as grievances, others are classified as complaints. I'm going to break them down a little bit because because you may find that your appeal is classified as one or the other, and I want people to understand why that's happening. But I also want to emphasize that you don't have to know what to call it, just appeal if you disagree with a decision. So what can be appealed? If there is a denial, reduction, suspension, or termination of a service based on a decision about whether that service is medically necessary or appropriate, that is something that you can appeal through a grievance. You can also make an appeal, though, if there's a failure to timely provide services. So if you are requesting a service, let's say you're getting personal assistance services, and they're having trouble finding an aide to fill in those services, you could make a complaint saying, I've been waiting 2 weeks, I was approved for this service, and I'm not getting it. You're not timely providing it. And sort of the touchstone there is like, it needs to be provided within a reasonable amount of time. This is for waiver services. So waiver services don't really have a strict timelines. Generally, 30 days is, about the max for most services, but it's true, a home adaptation decision could take a little longer. So we're hoping that there will be more guidelines on when is too long for a service decision. But for now, if you feel that it's taking too long, you can file a complaint. You can also file a complaint if there's a denial because of the determination that the service is not a covered benefit. So if somebody is seeking a home adaptation and the plan says, what you're really seeking is a repair to your home that's not related to your disability, they might deny that and say it's not a covered benefit. That is something you can appeal and argue, yes, it is, and here is why. You can also, the other types of denials that might turn into complaints are related to things that are not covered, like in the dental world. We see a lot of denials for implants, which are not covered by Medicaid. There's like some very rare circumstances where you can get them. I'm not going to get into. There's a whole other presentation, but it's common. If someone wants to challenge that, you would file a complaint. And then if there's a dispute of a payment issue, that can go through a complaint as well. The other thing that can happen is people can file a complaint really about any issue, about quality or accessibility of services. Remember earlier I said, if your service coordinator isn't calling you back, isn't responsive, you can file a complaint. Or if somebody was rude to you on the phone, those are things that can be complained about. They're not appeals strictly, but they fall into the complaint bucket. Now I want to say one thing about the denials, reductions in services. Right now, because of COVID-19, the Office of Long-Term Living has directed the plans not to make any reductions in people's person-centered service plan. What this means in practice is, especially for people who are getting in-home services like personal assistance services or nursing, that the Community Health Choices plans are not supposed to try to reduce the number of hours a person is getting or eliminate that service until this emergency is over. So you shouldn't see those. If you do, please call us. And in general, call us. Pennsylvania Health Law Project does a lot of work challenging the service denials by Community Health Choices and regular Health Choices plans. Okay, so I'm going to talk a little bit about what happens when you're appealing and it's a grievance and what you can expect to get in the mail. There are rights here, and there's a right to a written notice of all changes and denials before they happen. This is actually a constitutional right. It's called due process. So you're supposed to get written notice telling you that your service is being denied, or if it's changing or being reduced, that's going to happen. And that letter that the person gets will explain how to file what's called a grievance. So you file a grievance, and the grievance is basically a request to have the Community Health Choices plan reconsider its decision. We recommend that you participate in the grievance review and submit additional information you might have, like doctor's letters or medical records or witness testimony, to explain why you need the service that was denied or reduced. There's also a right to continue getting benefits you were already getting if you file the grievance in time. So if I get a notice that my personal assistance services hours are being reduced from 10 a day to 5 per day, that notice should come at least 10 days before that's going to happen. And if I appeal within those 10 days, I get to keep those services going throughout the grievance. So they can't be reduced beforehand. Even though I would have more time to appeal, in general, I actually have 60 days. Meeting that 10-day time limit is really critical to keep the benefits going. Now, if I lose my grievance, I have two options, and we generally have people do both, and they should do them both simultaneously. The grievance decision will explain how to request a fair hearing, which is a review by an independent administrative law judge of whether the decision of the health plan is correct, or an external review, which is a decision by an independent medical reviewer about whether the decision is correct. We encourage people to submit additional documents and for the hearing to have witnesses or to testify. The external review is just done on paper, but the fair hearing, you can go in person or you can do it over the phone. And again, when you request these things, once you get the grievance decision, if you request the next stage, the fair hearing or external review, within 10 days, you get to keep your benefits going unchanged. If you miss that deadline, they can terminate them. And it's really important to know that you can't say, oh, I'm going to do the external review, and then if that doesn't work out, I'll request a fair hearing. No. You have to do them both at the same time, because the right to continue benefits is from the date on the grievance decision. So if I get a grievance decision dated April 1st, and it's going to be effective April 10th, and I want to keep my 10 hours a day of personal assistance services going, I better request that hearing and that external review by April 10th. Okay, so complaints. This is really like, how do you appeal a delay in approving or providing services? There's usually no notice. Usually if an issue is like, I asked for this piece of durable medical equipment and I just never got a response, nothing happened, or there's no explanation. Or it could be a service coordinator says to you, I know you need a home adaptation for your kitchen and a modification to make your bathtub accessible. I'm only going to put in one of those requests right now, so it's more, so the plan will take it more, so they're more likely to approve it. You could say yes, or you could say, no, I wanted you to put in both. By not putting in, you've essentially denied me the other one. If they only put in the kitchen, you're denying me the bathtub by not requesting it. So that's something that can be appealed as a complaint. And basically, it's a very similar process. You get to go to the complaint. You can do it in person. You can do it over the telephone. You can do it by video conference. And you want to submit documentation and information. And then if you lose, there is also the right to a fair hearing or external review. There's also still the same right to continue benefits and services unchanged while there is an appeal going. So this is a process to really, keep the plans on their toes and keep them moving decisions along. And we have used this process, not a lot, but more and more to try to get people to get benefits, particularly when it comes to home modifications, where things seem to be stalled and the process is just not moving forward. Now, you can also complain about these issues to the Office of Long-Term Living, because it is concerning when things are taking too long and the process isn't happening. But that is not an appeal, so that's not going to give you any of the same rights as an appeal. Okay, so let's do a final poll real quick, and then we'll move on.
All right, so it's the final poll. I'm going to launch the poll. Hopefully everyone sees it. The question is, if you aren't sure whether the issue you want to appeal should be a complaint or a grievance, you should, option A, wait until you figure it out to appeal, or option B, file an appeal immediately and don't worry about what to call it. Okay, the answers are trickling in. I'm going to give it a couple more seconds. Okay, I'm going to end the poll. Share the results. Everyone should be able to see the results, hopefully. 90% of folks who voted said that you should file an appeal immediately and don't worry about what to call it.
Okay, thank you, Kayla. So,
Sure.
for the 10% who said you should figure it out and not appeal until you know which one to file it as, don't do that. Just if you want to appeal an issue, do it immediately, especially if it's about being a benefit that is being cut, because you don't want to miss that short 10-day time frame. Just file it. Complaints and grievances go to the same offices at each of the Community Health Choices plans. The plan is perfectly capable of figuring out how to classify the complaint. You can challenge how they classify it later if you disagree, but getting it in is the most important thing you need to do, because it stops the clock on your benefits being cut and also ensures that you are appealing before the time to appeal is over.
Okay, so we have a couple of more slides, so hang in with us because the last couple of slides are important and we'll give you some follow-up information. So we're asked often, well, what are like some of the top sites? Where do we get help? So the independent enrollment broker, how to apply for a waiver, you have to go through Maximus, who has the contract with the state for the independent enrollment brokerage. So we have those phone numbers. The Office of Long-Term Living Participant Hotline is an important number, 800-757-5042. That's an important number because the Office of Long-Term Living will help participants and their advocates problem solve. So if they're not hearing, for example, about who their service coordinator is, call that number as well as the plan. But let the Office of Long-Term Living know about it. Apprise if you have questions about your Medicare coverage. And here, I'm with PATF, but the biggest gift we can give you today is making sure that you know about Pennsylvania Health Law Project and that you have their contact information. So their 800 number is listed on there. I would also, and the next slide will tell you this, go online, go on their website, and the contact information again is on the next slide, and get their monthly newsletter. Going back again, PATF, we can help you learn about the full range of assistive technology, what is covered under what category, and I saw several questions coming in under the Q&A about assistive technology, and we're trying to get a certain piece of equipment, we're being denied. You can talk to PHLP about that, but you can also talk to us about it. Our field is really focused on assistive technology, and if we don't know the answer, we're going to tell you where you can go, including, by the way, our sister agency, Tech Owl at the Institute on Disabilities. If you want to learn a little bit more about it or try it, we're going to refer you to them. And lastly, your service coordinator. That's the key person in getting those services that you need through the waiver. Next. So here are the last couple of resources. The Community Health Choices Toolkit you can find on our PATF website. You can also find our financial education book. It's available online. It's 508 compatible. You can also ask for a single copy and we can mail it out. Amy mentioned a couple of times about safe ways to save, special needs trust, but also we put in there, and it was edited by the Health Law Project, more information about home and community-based waivers in our book, and it's called Sense and Sensibility, A Guide to Money Management. So look through our website, get the toolkit, find out more about us, our funding guide, as well as financial education. Log on to PHLP's website, get their monthly newsletter. It's free, it's wonderful, it's written in plain English. I can't recommend it enough. And then you can go on to the Department of Human Services website for Community Health Choices and subscribe to their email, and they have webinars that you can attend. You do sign up on the third Thursday of every month so that you can, you have an opportunity to hear what's going on. For example, they're going to add some amendments this summer, and so I'm in there already trying to make sure that they're paying attention to assistive technology and going to make it easier and possible for waiver participants to actually get that AT. So we have just a few minutes more. Amy, if you want, take it away.
Okay, I think we can take some questions, but before we do, I just want to, because I know some people drop off at this point, I want to thank everybody for joining us and encourage you to stay safe. On the next and very last slide that you will see if you remain is our helpline number. As a reminder, the PA Health Law Project is open for business. We're just all working from home with dogs in the background. Pam, do you have questions to bring forth?
We do have some questions, and I'll try and consolidate them. So first, we have a couple questions about the physician certification form. Alexandra Emanuel says that I've had a client try to tell her physician to check the NFCE box, but he felt as though he'd be committing fraud because she does not need to be in a nursing home. What do you say then? And then Jessica Fenton asked, is there an educational sheet or tip sheet that is available to help doctors understand what NFCE means? So how would you, what advice would you give for people trying to communicate with their doctors about this form?
So there's no tip sheet, but there is a definition that is included with the form that talks about how it doesn't necessarily mean the person has skilled needs. And we've done some provider education. I mean, if the doctor genuinely doesn't believe the person needs things like personal assistance services and help at home, then, you know, they're not going to fill it out. But if sometimes it's really about talking to the doctor and explaining, like, you know, does your patient need assistance with things like transferring or toileting, and, you know, those are the kinds of things that would qualify them for this nursing facility clinical eligibility determination. And, you know, they might say, well, they have a spouse there that can do that, but that's not the test. It's not about whether someone else is providing them, and the spouse might continue to provide some of that. It's about whether the person on their own would need nursing facility care if they weren't getting the kinds of assistance that they can get through the waiver. And it is a vague difference. I'm going to say it's like not, it's a definition that has a lot of wiggle room, but it's also sort of, you know, both almost seems like too narrow and too broad at the same time. It's a really hard definition to wrap your head around, so I understand why doctors don't get it. But they should definitely be reading the documentation that accompanies the physician certification, which explains in a little more detail what the requirements are.
Thank you. So I have
Amy, real quickly, because people are beginning to leave, we have a survey at the end that we're hoping people will fill out to help us develop other programs and webinars. So don't leave or we'll send it out.
Thanks, Susan. Okay, so the next couple of questions had to deal with people who are getting supports coordination, I'm guessing through the county ID program. So Luke Reynolds asks, if someone must enroll in CHC, is already enrolled with supports coordination, but not in an ODP waiver or nursing, do they have to change to service coordination through CHC? What if they plan to enroll in ODP waiver services later? And then Deborah Tate asked, how are the county ID programs informed of CHC enrollment for individuals who are getting county supports coordination, but in a holding pattern?
So the general rule is if people are getting supports from the county intellectual disability or behavioral health entity, they don't have to go into community health choices. However, if they are only getting supports coordination from the county and they are on Medicare and Medicaid, then they will be put in community health choices, and that is going to become where they get their service coordination. There's a sort of open question about whether or not they can continue to get some aspect of the supports coordination, but generally community health choices is taking over at that point. I do not know the answer to how people are informed, though.
Thanks, Amy. Do you have any advice for people who are 20 who are transitioning from EPSDT into who are transitioning out of EPSDT on their 21st birthday but will need waiver services immediately? How can families streamline the process to ensure waiver services start as soon as they turn 21? Pam, why
don't you answer this?
Yeah, I mean, I could say one big piece of advice is start early. If someone knows they're going to need like physical services like nursing, they can apply for the CHC waiver. I believe it's as early as 90 days ahead of their 21st birthday. And then there is a work group within the Office of Long-Term Living that's supposed to be tracking these transitioning youth and ensuring that everything goes smoothly. What we've seen is that sometimes there can be challenges making sure that first that the family is made aware that they need to apply for the CHC waiver. Second, making sure that the service coordinator or supports coordinator gets out there to start to get more information about the participant, and then making sure that the participants' information is communicated smoothly to the CHC MCO, the CHC plan, so that they're able to start services at day one. If you're concerned about, if you've got a youth who's transitioning, I'm going to encourage you to start early, and please feel free to call the PHLP helpline for assistance to try and navigate this process.
Let's do one more and then we're going to end.
Okay, for home modifications, do the beneficiaries need to own the home, or can they have a long-term lease? My grandchildren live with me and their mom, but the house is owned by us. I would say, just a general question, do you have to own the home to get home adaptations?
No.
No.
You do have to if you don't own the home, you're going to need homeowner approval for the modification, and the plan is going to want some assurances that you are planning to stay there for, I don't know, a reasonable amount of time. So if you're planning on moving in the next few months, they do not have to provide it, but should not be a barrier as long as the landlord is willing to allow the modifications. And if they're not, that raises some issues around the Fair Housing Act that can be referred to other organizations like Disability Rights Pennsylvania. Okay, so we know we have other questions. We're going to do our best to sort of reach out to people after the webinar and answer the questions that we haven't been able to. But I want to thank you again for joining us. Remind you that you can call the Pennsylvania Health Law Project Helpline at 800-274-3258 or email staff at phlp.org for technical assistance or for individual cases. And also the Pennsylvania Assistive Technology Foundation can be reached at 888-744-1938 or patf@patf.us. If you have questions about getting any kind of assistive technology or home adaptations or the loans that they provide. And I just want to say, everyone, please be safe, wash your hands, be careful out there, and thank you for joining us.
Yes, thank you all so much for your attendance and your engagement today. It was really great to have all of you, and thank you for taking time out of your work from home situation to spend some time with us. Please note, the post-webinar survey will launch in your internet browser after the webinar has ended, and it should only take a few minutes to complete. And your responses will be so helpful to us when we reflect on this webinar and when we plan future ones. Thank you again for your valuable input, and have a great rest of your afternoon.